Wait,
Hold on,
checking connection.
You got to turn off the wireless.
Okay.
We are live.
We are live?
All right.
All right. Welcome.
To Derm Bros, round 10.
Round 10. All right.
Well, thanks for being here with us tonight, everyone. It's our Halloween hair loss harangue special. And as you can see, we're having no mercy against hair loss. Dr. Greenberg and I have our gloves off. And Doc, what do we say about hair loss?
We're going to show no mercy to hair loss. Dr.
No mercy. We're going to strike hard, strike first, and have no mercy on hair loss.
So we've been looking forward to this one for a while. We get a lot of questions about hair loss. And I have had PRP injected into my scalp 7 times. I take Propecia, I do Rogaine, I do Retress. A lot of the things that we talk about are things that I personally do. And you today are going to get what done?
Well, so it's kind of interesting. We started filming all of these shows, and I realized watching the playback that I am starting to go bald. And I tell patients, I don't know, maybe 20, 30 times a week, you start Rogaine to keep what you got. And any regrowth is an added benefit. And so a couple months ago, I decided it was time to take my own advice, and I started using Rogaine back on August 1st. So I'm about 3 months into my Rogaine, and I usually recommend to my patients, start Rogaine for 6 weeks and then add in PRP. Keep what you got with the Rogaine and boost your hair growth. So tonight, I'm gonna do a couple of special live treatments. First, we're gonna have one of our superstar medical assistants come in and draw my blood, and they're gonna be processing that to generate platelet-rich plasma, which has all kinds of growth factors to help boost hair growth. And while that's processing, we're gonna have our superstar estheticians come behind me, where we have our Hydrafacial machine set up for a very special scalp treatment. Not only will they be cleansing my scalp, which as you can see, to keep it this shiny and greasy, there's a lot of crud in there. They're gonna do a special growth factor treatment called Keravive, where they're going to implant special growth factors after the treatment to help boost hair growth. Yeah. So I'm very excited.
I think that's going to be really good. One of the things that I really enjoy is having the Pronox when I get, which is laughing gas, when I get my scalp injected. It's not comfortable to get your scalp injected. We may end up bringing the fan in for you. Normally we have the fan running while we do the PRP injections.
So are we going to be doing Pronox, or are you going to have no mercy on me tonight when you're injecting my scalp?
There'll be no mercy, but maybe a little mercy.
Maybe a little mercy, maybe a little laughing gas.
Yeah, I think a little laughing gas. So I don't know if you want to start with the blood draw now.
Yeah, I think we can just maybe to kind of normalize it for everyone, we can show how simple these things are. Let's go ahead and get started on the talk, and we'll do the blood draw at the same time.
Okay. Yeah, and Michaela's our superstar medical assistant, and she's going to be doing a blood draw. And basically, with the blood draw, it's a tiny needle, and it's going to pull out your whole blood, and it'll be spun down. There's a special gel separator.
We use for you. Is this okay?
We use the Eclipse system, and Eclipse has a proprietary gel that we'll see in other slides that is used to separate out the red cells, the white cells, the platelets, and the platelet-rich plasma. So Dr. Cotter isn't used to getting stuck with needles.
I'm usually the one doing the sticking. Yeah.
That's correct.
And I've treated you a few times, Doc.
Yeah, so my scalp has been injected by Dr. Cotter at least twice. And basically, it feels a little awkward. And that's why my hair is as long as it is, actually, because Dr. Cotter was so good at doing those injections. So Michaela right now is doing the draw using a butterfly needle. And once we get enough of the blood, which is 20 cc's, then that will be spun down. They're going to take off the platelet-poor plasma after it's spun down. We're going to discard that. And the platelet-rich plasma is what is going to be used in order to stimulate hair growth. And the platelet-rich plasma has all the growth factors in it to regrow collagen, blood vessels, and hair. So the normal concentration, as we'll see, is what it is. This is not necessarily a standard treatment, but it's becoming more and more accepted over time. Some people are using... besides these platelet-rich plasma, some people are using stem cells to regrow hair. Those treatments are much more expensive. Platelet-rich plasma is used not just for hair loss, but it's also used in dental procedures when people get dental implants, and it's used on joints when people have like knee surgeries or ankle surgeries in order to stimulate wound healing. So it's a tremendous treatment.
Michaela, do you want to show them what you got? First stick.
Yeah.
Beautiful bright red blood. She's excellent. She's got a lot of practice. We do a lot of PRP for hair loss here. And she's going to go ahead and, you're going to co-band me?
You want me to wrap him?
Yeah.
Wrap it up.
Yes, sir. So this is Coban, and you want it done nice and tight to decrease the risk of bruising.
Perfect.
There you go.
Thanks, Michaela. Thanks, Dr. Greenberg.
Oh, Halloween
Perfect.
orange.
How festive.
Ah, very good.
All right, well, let's go ahead and get started.
So I'll get started with the significance of hair. Hair is protective, it's sensory, it affects body image, it's used for homeostasis and wound repair.
Absolutely. I actually had that conversation with someone today. I have a patient who has a burn injury, and we're doing a lot of wound care to get the skin to grow back. And we saw a great sign today, which was re-emergence of the skin from the hair follicles. So to Dr. Greenberg's point, that's where those stem cells are, and it's really helps folks regenerate their skin.
Some little hair factoids. There's 5 million follicles of hair on the body, and the scalp has 100,000 of those. So for some reason, blondes tend to have more hair, redheads tend to have less hair.
Huh.
Yeah, this is just the way it is. Over time, we lose our hair, which explains why we're here today and why you're getting your blood drawn. And then, over time, the facial hair develops in utero, and different people have different amounts of hair depending on their genetics and family heritage and things like that.
Great. I think one important point is that the hair cycles. So as it goes through life and as you grow bigger and your hair starts to grow, it's going through this cycle. And there's a limited number of cycles that hair has, which is why as you get older, you lose hair in your scalp in particular.
Yeah, and there are different phases of growth. So the anagen phase, where it's in the growing phase, the hair is actively growing. The catagen phase, where it's resting, and the telogen, where the hairs are going to be falling out.
Yeah. And so to help kind of prevent some of that falling out, that's what we use medications like Rogaine for, and obviously the PRP. And I think we're going to go ahead and bring in our estheticians, Autumn and Catherine, who are going to start preparing my scalp for the Keravive treatment as we continue on with our presentation.
Yeah, so about a month, maybe a month ago, the Hydrafacial folks came to the office and told us about the Keravive treatments for the scalp. And what's going to happen is Dr. Cotter's scalp is going to be cleansed, getting rid of all of the dead skin, getting rid of whatever hair products he has that are on his scalp. And you're going to see just a nice clean scalp afterward. And they're going to infuse a couple different products with the Keravive that have growth factors in them. So it's going to be a nice treatment for him. I know I certainly enjoyed it when I had it done. And the tube, the Hydrafacial tube, where it's shooting water in and then sucking out everything that's there, is going to be probably filled with some dirt, even though it looks clean to me today.
We'll find out. I think I'm going to break the clinic record for dirtiest scalp.
That would be interesting, because we did have somebody plug up all of the cords when they did it on the face, because normally it's on the face.
Yeah.
Where you do the Hydrafacial, and that gets rid of usually acne and dead skin. There's different things that you can infuse when you do the Hydrafacial, but on the scalp, we use the Keravive system.
Perfect.
Anagen is the growth phase, and different body areas grow at different rates. And so the hair on the scalp grows longer than the hair in the armpits, then grows longer than the hair on the eyelashes, than the eyebrows. And beards are the area that grow the fastest. I know Dr. Cotter can grow a wicked beard real fast.
And I think that I'm going to grow my beard back out in November for No Shave November.
Oh, that'd be nice.
I used to do it for prostate cancer awareness, and now it's kind of just a cancer awareness month. So maybe we'll have a clean shave on October 31st, Doc, and then we'll have a beard race.
Yeah, I mean, that would be fascinating. I would love to see who can grow the most hair.
Let's do it.
All right, let's do it. I'm all in.
Perfect.
Scalps are the second fastest area to grow, and so you can see sort of what the hair growth will be, but about a centimeter a month for the hair and a centimeter for the scalp. By the way, how does it feel?
It feels great. Yeah, it's very relaxing.
And Catherine, what are you doing to his head?
Right now we're just cleansing and exfoliating it first.
Mm-hmm.
Removing all the dead skin first.
Perfect.
And this is just talking here about the anagen phase, and 4 to 6 years is about how long the scalp hair grows, and then it falls out naturally, as you saw here, going from catagen to telogen.
And that's a really interesting point, Dr. Greenberg, because you mentioned two biological properties of the hair follicle that influence the length of hair. It's both the duration that a hair can be in anagen phase, which, as you mentioned, A scalp hair, you showed on your slide, can be 4 to 6 years. Some people are a little shorter than that, as short as 2 years. And then hairs grow about 1 centimeter a month, so you can go ahead and do your math. You might get about 6 inches of growth a year. So for people that have long anagen phase, they're going to be able to grow long hair. That's up to 3, maybe even 4 feet if it grows a little fast and you have a long anagen. So to get long hair, you have to have fast growth and long anagen phases.
Yeah, I think that's fabulous. And I think it's a good thing that we don't grow like Wookiee, hairs, like these long arm hairs. And
I know I had to shave mine today.
Did you? I've had mine laser hair removal up here.
I'm part Wookiee.
Part Wookiee. And then at any point in time, different hairs are in different phases. So when we do the laser hair removal, it only affects the anagen phase, the ones that are actively growing.
Exactly. And just for the sake of some of the things we're going to talk about later, understanding the cycle, the hair cycle, and the phase that any follicle is in is very important to understanding the disease process that's going on. On average, about 10 to 15% of your hair are in telogen phase, which is essentially a shedding stage. And that's the stage where your hairs are going to fall out. And when we talk about Rogaine, which we'll talk about later, which is 5% minoxidil, that takes all those telogen hairs and it boots them out. These are ones that are going to fall out anyway, and it just gets them out of the way. So people really get scared about that expedited shedding, but it's all part of the process. It was going to happen anyway. So you want to boot your telogens and preserve your anagens.
Yeah, and prolonging that anagen phase is super important.
This feels really cool and refreshing, actually.
Nice.
It's nice, yeah. I think I like it. I think I like it better than the face, actually.
Yeah,
it feels really good. Like on a hot summer day, I can feel the cool liquid cleansing my scalp. It's really nice.
And is his normal anything special that you've noticed, Catherine?
It's just getting super hydrated right now, but I think when we infuse the proteins and the growth factors, he'll feel even more like a refreshing sensation with the other tip.
Yeah. There's a question from the audience.
Thomas wants to know if you can do the Keravive scalp treatment even if you don't have hair.
Absolutely.
You can, yeah. It's a scalp treatment, really, because we're not treating the hair. We're treating the scalp.
I kind of like the way you're styling my hair. Maybe this is a new look for me. I like that part there.
That's pretty cool.
It's good. It's a good look.
So different things can disrupt the hair growth process.
No,
and
that's good.
There's anagen effluvium and telogen effluvium, and we'll get into that a little bit later. But I like how you had this picture with Macaulay Culkin about how there's only 10 to 20 scalp follicle cycles per lifetime. I didn't know that.
Once you run out of your cycles, you run out of your hair, and that's the process of miniaturization that we see in androgenetic alopecia, where as the hairs cycle more and more in a pathogenic manner, the follicles shrink down to a miniature follicle or a vellus hair, which is kind of like your peach fuzz, until they just don't come back. So it's really important to preserve that anagen phase, bulk up your hairs, and don't let them cycle down to nothing.
So this is one of those Daruma dolls, and I had shown that in one of our previous sessions. I brought it in, and the Daruma doll is a Japanese doll that you set your goals, and once you've achieved your goals, you color in both eyeballs. So believe it or not, I colored in my little Daruma doll here because I achieved one of the things that I wanted to achieve for 2020, which I thought was impossible, but it happened.
What was that?
Yes.
I thought it was survive 2020 and run a sub 2-hour marathon.
Yeah, well, that half marathon was canceled, so now it's just survive.
All right.
So
this is my general approach when I see a new consult for hair loss. It's kind of a funny story. I had an undergraduate student shadowing me a few months ago, and Dr. Greenberg asked him at lunch, "Hey, did you guys see anything interesting today?" He said, "No, not really." And I was like, "What?" At least lie.
I really enjoyed that. I thought it was very funny.
At least lie. But in kind of hindsight, I realized, he doesn't see things through my eyes. And it became clear to me that a hair loss consult, which you saw many of that day, he just sees me go in there, ask a few questions, examine the scalp, and there's a lot going on underneath the surface. And I like to take what I consider an enlightened approach, and the very first step in that approach is determining whether or not a patient has a scarring or a non-scarring alopecia. Scarring is very, very important to diagnose early and correctly. We're bringing in some additional supplies because apparently I am breaking the Hydrafacial machine with my dirty scalp.
No, it's not that bad. It's not that bad. I can't imagine.
But it's really important to identify patients that have scarring alopecias because scarring is permanent. Once you have permanent scarring, those follicles are lost. And you have to treat them very differently. And we've listed a few things here that we're going to talk about, like discoid lupus, lichen planopilaris, central centrifugal cicatricial alopecia, all of which are serious autoimmune scarring conditions of the scalp. There's many non-scarring alopecias. We listed a few common ones here. Obviously, androgenetic alopecia, which I'm suffering from, and the purpose of my treatments tonight. And then alopecia areata, a very common non-scarring autoimmune hair loss condition. And then, of course, telogen effluvium, which we see a lot of this in our postpartum patients. That's probably the classic time that it presents, is usually after delivery, 3 or 4 months later. Sometimes that's prolonged if a woman breastfeeds and you don't get your telogen effluvium until after cessation of breastfeeding. But it's massive shedding of those telogen hairs. So normally you have 10 to 15% of your hairs in telogen, but in a state like pregnancy, postpartum, or after a big stressful event or sickness, ICU stays, you get a massive shift into telogen and all of those hairs are shed and people get diffuse thinning and it's very, very distressing. So we'll talk a little bit more of that in a bit.
Yes. So once you have the proper diagnosis, the history, the physical exam, and sometimes a biopsy, and we'll see some cases where there were biopsy diagnoses that changed the management of the case.
Absolutely.
So male pattern loss is certainly the most common type of hair loss, and the classic bitemporal loss here and thinning. You see it in women right in the center where they're thinning out there. And that's considered just pattern loss.
What do you think about this unitemporal loss, Doc?
It's fascinating. I can't explain it. What do you think?
I think it's just a good comb over.
Yeah. Yes, I've been fooled by good comb overs. That's true. So for male pattern loss, FDA-approved treatments include the pill Propecia or finasteride, 1 milligram daily, and then Rogaine for men. Those are 2 FDA-approved treatments for male pattern loss.
Are there any potential side effects of Propecia, Dr. Greenberg?
Thanks for teeing that one up. Possible erectile dysfunction and difficulty with ejaculation.
Isn't that the reason why most people want the hair to begin with?
That is a fascinating and correct point. So a lot of times they want the hair so that they can get a mate.
But I mean, those are usually pretty rare side effects, right? I mean, we're talking less than 1 to 3% of patients, or?
I'd say that's about right. And if you have the side effects, typically you can just stop it and everything goes back to the way that it was. One of the other things with Propecia, now I've been on that drug at least 10 or 12 years, is that it decreases your risk of getting prostate cancer. But if you get prostate cancer, it'll be a more advanced form of it.
Yeah, that's potentially true. And I think some of that has to do with earlier screening and diagnoses. The jury is still out on prostate cancer, but I think if there's a family history of prostate cancer, it's something to really consider before starting that medicine. Yeah. I always tell all my patients, I think about hair loss therapies in a pyramid manner, because if we're going to invest time, money, effort in growing your hair, we should also be doing something to keep your hair. So I always tell everyone, if you're going to do anything for your hair, start with minoxidil and then build from there. And we've kind of layered things here based on FDA evidence, just like Dr. Greenberg said. Our 2 triangles on the bottom are the FDA-approved therapies, and as we move up, we have graduating levels of evidence. PRP, I think, has great evidence for hair loss.
It's FDA cleared, and I think I think it works great for hair loss. It's, for some reason, at least in our hands here, it seems to work better for African American women, and I can't explain why.
What do you usually tell people in terms of what they can expect for PRP?
I usually say about a 20 to 30% improvement if it's going to work for you.
Yeah, that's usually what I see too.
Yeah.
Perfect.
And we'll see a lot of photos with that. Are there any questions from the gallery? Okay. This is your case, Dr.
Yeah, so this is one of the first scarring conditions that I learned about as a dermatology resident, and something that I'm very passionate about. This is a patient of mine that came in actually for a PRP consult for patterned alopecia, so female pattern baldness. And we had kind of a serious conversation, because on exam there were areas with severe scarring. There was scaling around the follicles and burning and itch throughout the scalp. And this was a textbook diagnosis of Lichen planopilaris. And so teed up the medical regimen, went ahead and still did minoxidil, and after everything was stabilized medically, we went and we added back PRP. And we can go ahead and take a look at the next photo, Dr. Greenberg.
So you did PRP with this one?
Yeah, so this is a patient who was treated medically for Lichen planopilaris with both topical, injectable, and oral medications, as well as starting minoxidil, PRP, and our LED light stim helmet. And she's done absolutely fabulously. And when I saw her a few weeks ago, I asked if I could show her photos, and she said it would be her pleasure.
Wow, that's super encouraging.
Yeah.
And Catherine, what are you doing to Dr. Cotter's scalp right now?
Right now is the second step to the treatment, and this is the Keravive, the growth factors, and the proteins.
So for this, at least when I had it done, you could feel it pricking on the skin a little bit more. Do you feel that?
No, I guess I have thick skin. Feels great. I mean, I'm not moving my head too much for you ladies, am I?
No, you're doing great.
See, they're so good. I can give a live talk and they're just rolling right along with it.
Oh, wow. Wow, that's something else. It looks good. So this was my patient, and I thought that she had alopecia areata when I first looked at it, and then I looked a little bit closer, and it was scarring. And so I did a punch biopsy to confirm whatever the diagnosis would be, and it turned out that this patient had discoid lupus.
Wow.
And one of the treatments for discoid lupus is hydroxychloroquine, which during these days of COVID may or may not be something that's been used, but it certainly improved her hair loss, and you can see over time how the hair just started to come back.
That's wonderful.
Um,
It's one of my patients. Another consult that was for kind of hair loss. You know, you don't know what you're going to get when you walk into a hair loss consult, and this is a patient who had a boggy scalp with scarring hair loss in the central scalp, and I made a diagnosis of CCCA, or central centrifugal cicatricial alopecia, and we started on medical therapy. And this shows you, just over the course of 5 months, how much hair growth we were able to preserve, right? Because once scarring is there, scarring is permanent. You can rescue a few follicles that are at risk. And I think the next slide shows the play-by-play, which I wanted to include because I think it's really important to remind patients that anything with hair loss takes time. You really need about 6 months to assess whether or not a treatment regimen is working. And these are monthly follow-up photos, and I think she did fabulous.
Yeah, and it looks fantastic. This one I gave at a talk with the internal medicine residents, and they had something like this when I did internal medicine residency on our boards. And this is one of those conditions where it says this person also has lung problems in this scalp condition. What else could it be? And this is cutaneous sarcoid. Sarcoid typically goes to the lungs as caseating granulomas, but in this case, or I'm sorry, non-caseating granulomas, and in this case it went to the scalp.
That's quite a case of sarcoid. You had this one here, Doc?
Yeah, this was here
Wow.
in Nevada. So it's unusual. So steroids would typically be used to treat that condition.
Now, moving on to kind of non-scarring, but still autoimmune and inflammatory alopecias. This is a woman with classic alopecia areata. She actually had multifocal AA, a few areas throughout the scalp that had these kind of coin-shaped or round areas of non-scarring alopecia. And this is just 2 months later doing only intralesional steroid injections. So no pills, no creams, just treating it locally in the skin. And she had fabulous hair regrowth. And another patient that was happy to share her photos because she was so happy to have her hair grow back.
Yes.
David Greenberg asks, if you color your hair, does that damage hair or the hair growth?
It should not. The coloring shouldn't damage the hair or the hair growth.
Yeah, I agree with that. So done correctly, it's very safe. There are cases of people getting chemical burns from hair coloring. There's cases of people getting allergic contact dermatitis to hair coloring. And there's a couple classic culprits. For black hair dye, paraphenylene diamine is a very potent contact sensitizer. It can cause severe contact dermatitis, which in of itself could lead to hair loss. And then there's also ammonium persulfate in bleaches, in hair bleach, that can cause allergic contact dermatitis. What are we doing now, Autumn?
We're just spraying the Keravive take-home spray you'll be taking home with you.
Ooh, I get a take-home. I love it.
We're just going to spray a little bit of this, and then I'm going to gently massage it into your scalp. And then you'll be able to use this spray every day for the next 30 days.
Oh, cool.
It's basically
don't fall asleep.
It's basically the same as the vial, but just in a less concentrated form. So it's just
Awesome.
take home with you. Yeah.
And I can use that at night with my Rogaine?
Yeah. Yeah.
Perfect.
There's some people try to chemically straighten their hair, and sometimes when you break the disulfide bonds and you chemically straighten hair can fall out.
Wow.
So that'd be like the Brazilian blowout type thing. Yes.
Annie, are you okay 777 on Instagram asks, does lavender oil help with your hair?
I don't know.
Well, I'd say it doesn't hurt it. Lavender oil is an essential oil. And, tonight we're talking about hair loss, but I'm also an expert on allergic contact dermatitis, and I see patients on the weekly basis that have essential oil allergies. So as long as it doesn't harm your skin, I think it's certainly safe to use, but I don't know if there's any strong evidence to say that it's going to help preserve hair growth.
This is one of my alopecia areata patients, and you can see this larger patch of hair loss. And over time, these are monthly incremental injections of Kenalog, 2.5 milligrams per cc. There's improvement.
That's great.
Wow.
So she was happy. This is just an interesting nail finding. Sometimes you see nail changes, nail and hair can be
Yeah, this
related.
is a textbook case, trachyonychia, 20 nail dystrophy, this type of sandpaper nail change. And they actually, if there's any derm residents or medical students watching, the disease that's most commonly associated with trachyonychia is actually alopecia areata. I don't see it terribly often in my AA patients, but I have seen it in a few patients with alopecia totalis and alopecia universalis.
So your scalp is done.
Oh, really?
We're gonna
Great.
Take out the gunky so we can see
Oh,
what
yeah,
the
this is
scalp
gonna be
looks like.
fabulous.
Oh, boy.
This will be the highlight of my night. I'm almost 98% certain.
Oh, boy.
That is
Ooh,
so filthy. Can you
that's-
bring it over
Your hair
here?
smells good though.
Oh, thank you.
Bring it this way.
Wait, don't spill it on me.
Up to the camera. They can see
So,
it
so this is all of Dr. Cotter's dirt and dead skin.
Wow. What does it taste like?
Well, I'll pass.
Wow. That's pretty wild. Was this dirtier than yours, Doc?
It's pretty filthy.
It's pretty filthy.
It's pretty close.
I think I'm gonna need another one in 2 weeks.
Yeah. You do
Yeah.
about three treatments. About 3 treatments spread out.
So
every
we're
gonna
gonna
bring it
go
up
close
to,
the camera. And then what we should do is we should roll in the Pronox machine, and we're gonna have to roll out one of the other cameras. Yeah.
I'm gonna hand
I
this
have a
back.
question on Instagram.
Thank you, ladies.
And
Nice job, guys.
Great work. It felt amazing.
and move the camera really quickly so you guys
Yeah.
out.
I want to do it again though, because I feel like you need one more of the
One more.
I think I need one more too, so let's
Yeah.
do it again. I love it.
It was like, you needed, we only had one of the.
Oh, it feels so nice.
We
Thank
need
you.
to- We need to do more.
Let's do it. So we'll do another
I
one
need
again.
one.
Yeah, we need more up front,
And
so
then
let's
we'll
do it
roll
again.
in Pronox for Dr. Cotter here. I think it's going to make giving the lecture a lot more fun. I promised myself I wouldn't drink for your injections because
Yeah.
I don't drink and inject.
Yeah, please don't. It's against the
Yeah.
law.
We
Yeah.
can.
We don't do that.
I am drinking water though because I wanted to stay hydrated.
Cheers.
I am.
Okay,
All right.
then while we're at
Do
it, I do have
you guys really drink?
No, we drink water.
Well,
Okay, so I do have a question while we're waiting to get that Pronox from Sunflower Girl 585 on Instagram, and she asks, "Is it true that wearing tight buns or ponytails can cause hair loss?"
sure. So traction alopecia. So some people over time, as they do different hairstyles, they can make their hair fall out.
Yeah, so the tighter you pull your braids, the tighter you pull your ponies, the tighter you pull your buns, you're actually going to cause chronic stress and shear pressure on the follicles. And over time, that can lead to permanent hair loss. A lot of times you see it on the temporal scalp and the frontal hairline, as well as along the temporal parietal area here.
And then the question here is, what other underlying conditions should you consider? These are all people with alopecia areata. This here is what's called an ophiasis pattern, which is along the sides and in the back.
Very challenging to treat.
Yeah, much more difficult. And so I always check for an autoimmune panel on anybody who has this condition, and I will check for thyroid disease and diabetes and different other autoimmune conditions where instead of attacking the hair follicle, the body's attacking the pancreas or attacking the thyroid or something else similar. So this is our Pronox machine that's being rolled in. You can't see it yet, but the Pronox is laughing gas, and it's a combination product that has nitrous oxide and oxygen. It takes the edge off, so it makes it more comfortable to do the procedure. We can put it right in the.
No, they'll put it on
Keep
the
it to the
side.
side.
Yeah.
Have you ever done Pronox, Dr.?
I have never done it. Yeah. So what's the benefit of doing the Pronox, Dr. Greenberg, as opposed to doing full-on nitrous oxide?
Well,
Am I going to be able to drive home after Derm Bros tonight?
Yeah, it's a 10-minute
Okay.
washout
Okay,
period.
good.
So it's much more safe to do this one. And what I would do is I would pull that cord so that it's extended everywhere.
Okay.
This will be your cord, so the next time you get a procedure done, everybody gets their own tube that connects to the machine. It's a one-way valve, so it doesn't go back into the machine. And then it's a mix, 50-50 of laughing gas and oxygen. So Mikhail's going to turn that on.
All right, here we go.
And
All right.
get it ready for
So
you.
back to what you were saying, though. What other conditions should you consider in someone who has an alopecia areata-like rash?
Let's see, we talked about autoimmune disease, thyroid, diabetes,
There's a big one.
dermatomyositis.
You don't want to miss it, and you also don't want to touch it with your bare hands.
Oh, syphilis?
Syphilis.
Yeah, we're going to show some pictures of that
Okay.
too. Yeah. That would be sort of an infectious disease, and that's right here, this moth-eaten alopecia. I've seen it, and it can be confusing and difficult to diagnose.
Yeah.
I would take a hit of that thing and breathe in deep, do a couple deep breaths. It may be better for you to straddle the chair so you don't fall out. You're a bigger guy than I am.
I'm not going to fall out of the chair.
All right. And the areas we're going to focus on today, up here on your temples,
Yeah, we'll kind of go across. Oh, I feel it. We'll kind of come across the frontal hairline here. It's funny, my voice seems to get deeper, but yours gets higher when you do the Pronox.
And that's funny and true.
Yeah, I want to focus here because you see this is way farther back than this side. It's very bizarre. And I'll try to continue with the presentation.
Do you want to? Okay, yeah, that'd be fine.
Yeah, why not? I mean.
And then Michaela, do you want some air on you, or you think you're okay with this?
I mean, let's just do it. No mercy, right? A little squeezy ball?
No mercy for hair loss.
All right, so this is an example of an infectious type of hair loss. This is a patient that I saw that was misdiagnosed initially. She had something called a favus, which is a severe ringworm infection of the scalp. It's like tinea capitis gone wild.
We'll have you advance the slides.
And what you see here is the progression over time. Initially treated with oral antifungals, and no,
Okay, leave it up.
yeah, leave it up. Oral antifungals to clear out the infectious burden of the dermatophyte tinea, and then when that resolved, there was so much inflammation that this patient had hair loss. And the question was, oh my gosh, is this going to be permanent hair loss from scarring from the severe inflammation?
All right.
My head feels a little light.
All right, let's just hold on for a minute. We're gonna get back to this in a second. So this is Dr. Cotter's PRP. This is his platelet-rich plasma. This is the gold that is going to help his scalp. I didn't realize it's that funny, but it's just funny because I got a mohawk and your PRP in my hand.
What do you have in your hand?
It's a 27 gauge needle.
Ooh, that sounds kind of big.
It is a big needle, and this is your golden amber-colored platelet-rich plasma.
Do you need to clean my scalp?
It's already been cleaned.
Okay, I missed that
And
part.
Keravived. All right, so we'll leave you there. Just relax.
All
We're
right.
going to start on the side. And we're going to do multiple injections.
Well, that doesn't hurt at all.
It's because Dr. Cotter's a black belt in Taekwondo.
I realized today we had these Cobra Kai costumes, and I thought I should just wear my real black belt, but I didn't want you, Dr. Greenberg, to feel left out.
That's okay. I bought a real black belt on Amazon from somebody else.
It's way cheaper than paying for the classes, and it comes in 48 hours or less.
This is true. All right, so we're concentrating on the frontal hairline. I did half a cc in each area. Take it easy. Take it easy. Doing all right?
Oh, I'm doing great.
Oh, good.
Dr. Greenberg has having no mercy on my scalp.
No mercy for his hair.
Now, how much volume are you depositing in each injection?
I'm doing aliquots at 0.5 cc's.
0.5 cc's. Oh, wow.
Yeah.
Go big or go home. So you're just doing like 6 injections per syringe.
Boluses.
Okay.
That's correct. All right. You good?
Yeah.
Okay. And Dr. Cotter's super tough because a lot of people need a fan.
I don't even need this Pronox.
Yeah, but it's fun to use. Good. And now I'm going to come along the top here.
Oh yeah, get it in the top.
And Dr. Cotter, you have great hair.
Oh, thank you, Dr. Greenberg.
And we're getting back to the crown. Good. And we've got one more syringe left. You're enjoying the laughing, guys? All right. This will be the last one. No mercy for hair loss.
No mercy.
So Dr. Cotter and I have been practicing in our dojo all week for this. Getting ready.
No mercy.
And I'm going to go back to the area that bothered him the most with the last little bit of... good. Take a hit. Nice. With the last little bit of PRP. Going a little bit further along the frontal line.
Now, will you inject in areas where there's no hairs?
Yes.
To try to reactivate some of those, kind of wake up those sleepy follicles and get them to go from back into anagen?
That's the goal, is to stimulate some hair growth. And that's what I did right along this triangle here that was bothering you the most.
I hate that triangle.
I understand.
I'm going to start using Rogaine on my son. That way he can have perfect hair forever. But my wife says it's not a good idea. I think she's probably right.
Yeah,
she's my
she's
voice
always
of
right.
reason.
So, hello, Brie.
Hi, Bree. Love you.
He's doing great today. All right, so that's it. We had 9 cc's. 9 cc's have been injected, and there's no more PRP left. So what did you think?
Oh, I think it was fine.
That's good.
That was so fast. It didn't hurt at all.
So I'm going to leave these here. We'll dispose of them later. We can just leave them if you want. Yeah.
Do we have to turn this off now?
Yeah, no. Sorry, Dr. Cotter.
All right.
But you did a great job.
Thanks, Dr. Greenberg. It was awesome. Good work. Good job, Derm Bro.
Derm Bros.
All right.
All right. Did you want to finish? So this person was given an oral antifungal to start. So they didn't.
Yeah. So this is someone who had come to me after being misdiagnosed initially and was treated in a way that I can't recall right now. But I did start this patient on an oral antifungal for the severe tinea infection of the scalp. After the infection cleared, there was a lot of inflammation left over, and that inflammation led to a lot of hair loss. And I was a little concerned, so I went ahead and I did a biopsy to make sure that I hadn't misdiagnosed her. And I didn't, which was very great. And I treated the residual inflammation. Am I leaking?
Yeah, we just got to dab you a little bit.
Oh, that's okay. Hey, no blood, no foul, right?
No mercy.
So we did a biopsy. I showed severe inflammation, and I treated her with topical steroids. And after a couple months of that, she got regrowth all throughout the area. Around it, it regrew very quickly. And then even within the area that was primarily involved, she started to get new hair growth, which probably we can't see on the live feed, but these slides will be up later.
I mean, this looks fantastic. And
She was very happy.
What was the diagnosis?
It was a favus, which is a very severe tinea infection.
Great.
Thanks, Michaela.
So I really enjoy this slide, and I enjoyed when I speak to the residents in internal medicine, I like to show them this one because it shows the difference between anagen hairs and telogen hairs. So Dr. Cotter, this is probably a softball for you, but which one's the anagen hair and which one's the telogen hair?
Oh, the rumpled sock.
Rumpled sock. That's funny. I always
Or the
taught,
club hair. The
yeah,
club hair.
I always taught hockey sticks and clubs.
Oh, that's so funny. You know, I made up this mnemonic when I was a derm resident that, you know, you think about Bam Bam, he was this little baby on Flintstones, and he had a club like to hit things with. So I used to remember, well, Wilma, or maybe the other one, I can't remember now, but the mom, Betty would get telogen effluvium because she just had a baby, Bam Bam, and he's got the club. So the club hair, telogen.
That's right.
Telogen effluvium.
Yeah, that's
Clubs.
very good. I have a friend of mine who just was diagnosed with breast cancer, and he is getting chemotherapy. It's very rare for men to have that. But
you know what, Dr. Greenberg? I think in honor of your friend, I'm going to wear my pink scrubs on Tuesday for breast cancer awareness.
Dr. Cotter, you have made my year. Thank you.
You're welcome.
It's lovely. And
He's a good guy, and I like him a lot. And
He's a
I'm
great
so
guy.
sad to hear that happened.
But he's getting chemotherapy now, and his anagen hairs, which we had talked about are the growing hairs, have all fallen out. So he has anagen effluvium, and that's the club hairs, or I'm sorry, the hockey stick hairs. When those fall out, you know, there are many more anagen hairs than telogen hairs, so it's much more obvious.
Yeah.
I have a question. How does tinea on the scalp occur from Sunflower Girl 585 on Instagram?
Yeah, there's a few different types of tinea infections. So the medical diagnosis is tinea capitis, and you can pick it up from animals, cats, dogs. You can get zoonotic infections from farm animals. I even had a patient with tinea from a pet rat in the past. Family members can pass it between one another. So if someone in the family has a tinea capitis infection and you share a hairbrush, you can transfer it. You can get it from pillowcases. I've seen people pick it up at barbershops. I've seen wrestlers pick it up from the wrestling room.
Yeah, wrestlers.
So anywhere you have skin, you can get tinea potentially, including the scalp.
There are so many hair conditions, and just during residency, we would, and for our dermatology boards, they'd show us pictures of hairs, and Manilothrix is beaded hairs, and there's pileannulati and pileatriangulati. There are multiple types. Trichorexis nodosa is the most common, the frayed hair, broomstick-looking hairs under the microscope. All different types of hair loss and hair conditions, and you know sometimes a biopsy will let you know. Sometimes a trichogram where we just look at it under the microscope, you know, hair pull versus hair pluck.
Absolutely.
All that stuff. But
so this is the importance of making sure you're seeing a board certified dermatologist. There's a lot of hair experts out there, but if you don't know what Trichorexis invaginata is, then you're not a hair expert. And, you know, I've had patients walk into clinic and I've made a diagnosis of a severe congenital ichthyosis called Netherton syndrome by doing a hair prep on the spot, that trichogram Dr. Greenberg was talking about.
Sure.
So you have to know everything if you know anything. And that's really important, especially with hair.
I have another question in regards to PRP from David Greenberg, asking how many times do you need to inject PRP and how often?
So typically, and we'll get into, we got a whole section coming
Yeah.
up, but it's once a month for 4 months and then every 6 months. There's no standard for PRP, and different systems are different, but that's one we're doing here.
Yeah, I usually tell patients don't bother doing it unless you can do 4 treatments. Month 1, month 2, month 3, and then a booster at month 6. Some of my patients, they hit month 3 and they say, well, I don't want to wait, and so then we'll just continue monthly or every 2 months based on the patient.
I just like this surprise me. It's definitely this year. So this is PRP. This is what we did with Dr. Cotter. His blood was drawn, it was spun down, and what you didn't see was Michaela drawing off the platelet-poor plasma and then getting the platelet-rich plasma. And I'm going to have a picture that shows that. And this is just their proprietary gel separator. And you can't just use a regular tube that isn't prepared for doing PRP because they're not meant to be re-injected, and this one is. And the reason you throw off the platelet-poor plasma is if you look in this graphic, there are areas here where there's just not a lot of platelets. The bulk of the platelets, they're heavy, and they're falling down in this lower area. We're doing the platelet-poor plasma at times when we're doing a combination of injections in the scalp to regrow hair and as an anti-aging therapy, so we don't waste it.
Waste not, want not.
Fair enough. I agree. And then this just goes over some of the costs that we do and the laughing gas. The laughing gas isn't included if it's something that you want to do, but it's an add-on for those who would like a little bit more comfort. I don't know, did you enjoy it?
I didn't feel a thing while you were injecting me.
Really?
Yeah, it was over like that. I mean.
Did you feel like you were in a time warp or anything?
No, I don't know.
Okay.
Felt fine.
All right.
Yeah, it was
well,
good.
you were a little funnier.
A little funnier. I'm not very funny. Dr. Greenberg is a funny guy in the
I'm sure
practice.
You hold it back. You were funnier than I am. So
Oh, wow.
This is me getting injected by Dr. Cotter.
See, it's so funny. I do different aliquots than you. I'll drop about 0.1 per injection site. So I guess I torture folks because I give them a lot more injections.
Yeah, I think it's like making meatloaf. Everybody has their own recipe.
Yeah.
Everybody thinks theirs is the best. I think just a shout out to Chef Gordon Ramsay on TikTok. If anybody needs somebody fun to watch on TikTok, Gordon Ramsay's TikTok account is fantastic. He does these side-by-sides of people cooking and him discussing
Great.
how he would make it, and it's
That sounds
hilarious.
great. He's a funny guy.
Yeah, and our videographer, our producer, Philip Marcus, has worked with Gordon Ramsay, and
Cool.
shout out. This is just an article that I wrote about how to use PRP in the practice. And these are photos from Dr. Rappaport of patients who've had multiple treatments. The problem with hair loss treatment photos is you really have to get good standardization to your photos. Somebody who had 5 treatments by Dr. Rappaport, patient with 3 treatments, central part, you can see how the hair's grown back. Here's another patient on the side, you can see the hair growing back. And then this is somebody who I would say probably it wouldn't work for you, and yet there are people who just want to give it a go, and there's nothing wrong with giving it a go. It will improve what you have, and you can do sprays and different things to add to what you have if you're not wanting to do. Thank you, Michaela. If you're not wanting to do a hair transplant. A hair transplant would be what I would recommend for this person. Another gentleman, 4 treatments. We'll get into the other therapies now, whether it's biotin, hair transplantation, the Hydrafacial that we saw. There's a new JAK inhibitor. We've done some compounding.
Mm-hmm. I wrote for compounded tofacitinib today, actually.
Yeah.
Yeah.
That's pretty cool. Latisse, which is the eyelash extensor topical.
And it works great.
Microneedling can be done. You had the Keravive, but microneedling would go a little bit deeper than the Keravive, but not as deep as the injections that I did today. And then the Retread shampoo, the Propecia pills, and then the supplements like Nutrafol, which is a combination of antioxidants, and Viviscal, which we don't sell in the office, which is fish scale extract.
My mom loves the Nutrafol. She buys it 2 bottles at a time, and she'll text me, "Can you bring me some more Nutrafol?" Loves it.
Yeah, and that one, it has vitamin E, ashwagandha, biocurcumin in terms of being antioxidants, and then saw palmetto, which works as does Propecia on the conversion of testosterone and dihydrotestosterone. And this is the TheraDome helmet. It's a 678 nanometer red laser light, and it's a laser because it's just one light.
One wavelength.
Correct. It's one wavelength of light that's hitting the area, and this is me wearing the helmet. We have the helmets here. I'm not as good at wearing them as I should. I think the spikes make it so I just can't put it on anymore.
Yeah, I don't think you could fit it with that mohawk.
No, it's not going to work. This is me getting the Keravive treatment.
Yeah. It's like we'd like to do a lot more. The problem is the expense.
Yeah.
But
I know, I showed him the quote.
And this is the close-up of my head, but Dr. Cotter's was the same.
Cheaper than
And here's mine, so we can see, compare tubes.
Oh, yours is way dirtier. I mean, that looks like old milk that's been left in the garage or something.
Yeah.
I think the whole thing.
Yeah.
Wait, do you still have it?
Yeah, it's really gross. I think once you see how much filth is on your scalp, and I had shampooed and conditioned my hair prior. I don't know if you did that today. I assume you did.
Yeah, I washed my hair today.
Yeah.
Every day.
Yeah. So you can see it's just it's not intuitive, but unless you're cleaning your scalp, you're not getting rid of all that stuff that's on your scalp. And so that was me posing with my filth. This is just the PRP. So as I showed earlier, this is what was drawn from Dr. Cotter. This is me, but it's the same idea. And then you get rid of the platelet poor, and you're left with the platelet rich, which is amber in color. And this is me injecting. And this is me talking about PRP and the laughing gas. Laughing gas is a big hit. People just love the laughing gas.
It really does take the edge off.
And this is me after 4 treatments of PRP. You can see that some of these hairs have started to come in doing the PRP. And this is the Pronox, just talking about that. And that's it.
Thank you. Great.
So I think this was a great way to end round 10. We had Stephanie Cook was our ring girl from Top Rank Boxing. She came in and started round 10, so I'd like to thank her for doing that. It's been fun fighting you.
Thank you for treating me, Doc.
Yeah, thank you,
I appreciate
Dr.
it.
Cotter.
It felt great.
It's been a great experience, a great run, and we'd like to thank you for watching this. If you have any questions about hair loss, or if you have hair loss, we have different things that we can do to treat it in the clinic. And if you'd like a cleaner scalp, I know that Catherine and Autumn are ready to go in terms of using the Hydrafacial.
Yeah, I think one thing that we touched on, we talked a lot about androgenetic alopecia and cosmetic treatments for hair loss today, but I hope it's not lost on anyone watching that the most important step you'll ever do if you're suffering from hair loss is getting a consult by a board certified dermatologist. And the reason why is you may not have the hair loss you think you have. And I have numerous patients that come in wanting PRP, wanting to talk about biotin or Nutrafol, and they have a scarring condition in their scalp and they need medical treatment. So the nice thing about coming to a medical office with aesthetic services is you're going to get the full suite. Every single benefit you have. You get the eyes of a board certified dermatologist who's going to diagnose you accurately, treat you medically if you need that, as well as administer cutting edge cosmetic treatments, and tag team with our outstanding estheticians to really provide a 360-degree treatment plan and care for you.
Yeah, I agree. That's a benefit of coming to the clinic. And I've had the same thing. People coming in, yes, I'd like to get PRP, but there's an underlying condition that's causing their problem.
Yeah,
and
exactly.
they may not need PRP. It may not be the right treatment for them.
Mm-hmm. Great.
All right. So I'd like to thank everybody for watching our round 10. And we'll be hard to work maybe mid-November, maybe December for round 11.
Sounds great.
All right. Thank you, guys.